Welcome to the Wholehearted Wellness Podcast. As a friendly reminder, the Wholehearted Wellness Podcast is not a substitute to receiving mental and physical support from a licensed wellness provider. We encourage you to speak with your wellness provider prior to trying any therapeutic modalities mentioned on this podcast. Welcome back, you guys. I am so excited about this podcast today. I have one of my dear friends and somebody that I refer to often, Alan Green. Alan, thank you so much for being here with us today.
So excited to be here. Miss working with you guys, but glad that, we still get to, to collaborate a lot and kind of do things like this and, get our messages across.
Absolutely. So, Alan, you have got your hands in a lot of cool things. You are naturally an entrepreneur at heart. You're naturally a wellness thinker. Tell me about all your different endeavors that you do.
Yeah. So, my mental health venture, I guess you could call it, started when I was invited to interview for a position at a ketamine clinic, which I was hired on as an infusion nurse and then eventually became an owner. And that's where my mental health journey kind of started, just watching the first couple of patients receive ketamine treatment and their life just completely turn around. I fell in love with it immediately. I was like, this is what I want to do for the rest of my life.
Yes.
Went home probably that night and, and told my wife, I said, I know what I want to do when I grow up. And here I was 35 years old, I guess. Had been in nursing since I was 23. And, this was kind of my first real venture into mental health. And from there, it really took off. I went back to school, got my master's degree in psychiatry, and then eventually opened up a private practice. But yes, I do love to get involved with absolutely anything that I can. I'm on the board of directors of a company called Love of People, and we're starting to, venture out into more mental health spaces. Soon we're opening up a business for dementia patients and Alzheimer's patients. It's actually a day center. It's going to be called Bell's Tower. So I'll keep an eye out for that. Not to plug myself too much, but it's definitely something that I can't get enough of, to be honest.
Yeah.
Mental health has so many avenues that it's not just about medication. There's so many different things that we can do, and I want to make sure I have my hands in as many of them as I can.
Absolutely. Well, and I think you've even done stuff with drip IV,
Mm-hmm.
correct? And I think maybe starting something with medical marijuana.
Well, the medical marijuana still hasn't taken place yet.
Okay.
Just because we're waiting on some of the laws to change in Louisiana. But yes, I do own Drip IV Therapies. That's probably the one non-mental health thing, but it does have a lot to play with mental health. One of the things that I've always wanted to get into with my own practice is more of a functional medicine route.
Yes.
Rather than just focusing on prescription medications.
Yeah.
And that's something new that's going to be coming very, very soon to Greenhouse Psychiatric Services. So, that's something that I'm very passionate about, and I love just knowing that you can utilize vitamins and minerals and things like that to improve your mood and your overall well-being. So at Drip IV Therapies, we do IV micronutrients. We do IV infusions for vitamins and different minerals and things like that. Hangover cures, all of that. And we actually just recently opened up our second location in Baton Rouge.
That's awesome.
And we have an amazing nurse practitioner that is running that over there right now, and they're starting to incorporate a lot of different new avenues as well.
Yeah. I think that's one reason why we connected so well is we love having a holistic approach and very much functional medicine. I know when Alan and I were in the same building, I think there were times when we had downtime just brainstorming, ooh, this would be cool if there was Pilates here and hyperbaric and PEMF. Like we love being able to incorporate such a wide variety of things to bring people holistic wellness and healing. So
Absolutely.
that's awesome. So you said it earlier, where you utilize for medication management is Greenhouse Psychiatric Services. So something that listen, if anytime I know somebody that needs medicine, my whole staff are like, we have his cards everywhere.
I appreciate that. Thank you.
We know he gives such tremendous care, very good insight, but you can probably hear it in his voice. He's just got such a big heart. And I remember the first time we met, you said, "Listen, I may not know everything, but I care." And that's very evident in who you are and what you're doing.
Yeah. So, and like you said, my job is medication management, and that's what I do. Uh, am I always a believer in medication? No. I mean,
Sure.
that's
Oh,
just the
yeah.
honest truth. Yes, that is what I do. And I don't really have any other avenues to treat mental health patients except to prescribe medication. But, there's always a way that we can utilize other methods, including vitamins, including, counseling and
Yeah.
all of that. And I just do, and I do believe that, and I'm sure all my patients are probably eventually going to get sick of me, telling them, hey, look, this medication is not going to cure this. I
Right.
promise you that. It's
Right.
not going to fix it. All it's going to do is give you a better ability to cope with what some of these things are going on in your life,
Yeah.
Some of them, they're necessary forever. Some of them, hey, well, maybe we can get you on it now, get some other things fixed in your life, get some good counseling going, and then we'll pull you back off this medication. And that's
Right.
just the way that I believe.
Right.
Would I eventually run myself out of business? In theory, yes, but I think there's enough patients that, that's never going to be the case, unfortunately.
Sure.
But,
Sure.
sometimes I hate the fact that, in our line of work, we depend on sick people to make a living.
I
But,
know. I know.
it's there's always going to be sick people, and there's always hopefully going to be enough people out there that do care,
Sure.
in order to provide that.
And don't take advantage of them,
Absolutely.
Yeah. Well, and I think you said it well. I have seen where I'm working with a trauma client, and because we're diving into the deep nitty-gritty, and they don't necessarily need to be on an antidepressant long term, but they need something to help their nervous system regulate while going there, while
Yep.
going to the deep trauma. And then maybe after a year they don't need it and they can wean off of it.
Absolutely.
I remember when I started my trauma healing, my anxiety and depression was through the roof. I was having panic attacks, and my trauma therapist said, "Okay, sister friend, it is time to go see a
Absolutely.
psychiatrist."
Yes.
And I got on Prozac, and I did the trauma work, and she said, "You know what? Let's see if we can wean you off." Well, I weaned off, and honestly, that whole year and a half I was not on it, I learned pretty quickly, no, this is actually something my body needs, and it's genetic in my family,
Hmm.
and it didn't matter how much work that I did, my body needed that little extra boost.
Yeah.
And so it's, sometimes you find what works for you and don't, but there's definitely no shame for those that may need to be on
Oh,
medication.
absolutely not. And that's one of the things that I think, we're hopefully not always going to battle, but right now I think we're making headway, but we're constantly battling the stigma that has unfortunately been placed on mental health. And,
Sure.
that's one of the things that I say every day, I fight an uphill battle of trying to decrease the stigma behind mental health, and that, look, it's okay to be on medication, whether it's forever or whether it's just a temporary time.
Sure.
Nobody bats an eye if you break your arm and you go and you have to get it fixed and maybe
Right.
get on some medication, or if you get an infection and you've got to get on an
Or
antibiotic,
thyroid
or
medicine.
yeah, I mean,
You know?
nobody cares about talking about that. Nobody
Right.
says anything. You can tell everybody, and nobody bats an eye. But tell one person you're on Prozac, and all of a sudden, oh my gosh,
Right.
what happened? So it's unfortunate that's the case, but like you said, maybe there is an opportunity to use these, what I call tools. These
Right.
medications, I look at them as their tools, and especially like with trauma work, if there's what are you going to get out of counseling if you sit in front of a counselor and you're at a 10 the whole
Mhm.
time,
Mhm.
and you can never get down below a 10? What is your session going to accomplish? What are you
Right.
going to take from it? That is where the medication comes into effect. And then just that daily anxiety, that daily depression, those types of things that we see the majority of. Yes, I mean, we do treat much more serious illnesses, but the most common things is, the anxiety and depression. These patients, I get it. Some of them couldn't survive without a
Right.
little assistance. That's where those tools, medication, comes into play.
Sure. Yeah, it's definitely a balance between recognizing when you're just using it as a crutch and when you are like, listen, I am utilizing everything that I can. I'm utilizing all my tools in my tool belt, but I am not getting where I want to be. And so, yeah, absolutely. What are some of the more natural remedies that you recommend for those that maybe have had genetic reasons that their body does not like medication? I know I have a client, poor baby, her body doesn't like any SSRIs. And
Hmm.
she's like, I don't know what to do with this REL. And I was like, girl, I don't know either, but
Yeah.
we've talked about omega-3s and
Hmm.
L-theanine, but what do you do in those situations? What do you recommend?
Well, unfortunately, right now there's no real guidance on that. And I mean, this is becoming a new thing. That's why I've always wanted to, incorporate functional medicine into my practice.
Sure.
And like I mentioned earlier, coming soon, we are going to finally have that available. One of the things that a colleague of mine in the past told me when we were talking about functional medicine, I asked him, I said, how many patients that you see when you test their gut health and
Mm,
have a comorbid mental health illness, how many of those patients have a good gut health? He said 0.
mhm.
100% of those patients always have something going on with their gut. That's just one avenue, you
Where
know.
all our serotonin
Absolutely.
is created, is in our
Absolutely.
gut.
Yes. So if we don't provide the right environment in our gut, that's the start.
Yeah.
Unfortunately, there's just not really much that we can do about that. And so there are, luckily that is becoming a more common thing now. We have a few functional medicine providers here in Lafayette, and we're going to have a new one very soon. And hopefully from that, we'll be able to start opening up more avenues. One of the things that I do notice is hormones.
Yeah.
Hormones play a huge role in mental health, and especially nowadays with all the hormones that are in our food and
Mm,
all these microplastics that are in our bloodstreams and all of that. It's changing our hormones, and I'm seeing more and more in both men and women early age. I mean, I'm talking about late 20s, early 30s that are showing up with hormones that are just completely out of balance.
wow.
And I've recently sent several patients in their early 30s to go get hormone testing, and sure enough, they came out. And now is that a perfect fix? No, but that is definitely one piece of the puzzle that
Right.
we've got to start, looking at, not just throwing more medications at. I mean, that's one of the biggest struggles. I've been lucky, and I'm sure that there's other, providers that would consider themselves lucky that there's a good population of patients that do respond well to medications. But I guarantee you that every single provider that does mental health medications has the issue of having, this population of patients where they'll try 10, 15 different medications on and just cannot find the right one, the right mix, or whatever it may be. And it's almost kind of like we're just throwing
Guessing.
medications at it. And
Yeah.
that is the number one thing I absolutely can't stand about my
Right.
practice, but it is necessary sometimes. And sometimes we can't find the right thing. And I think that is where counseling comes in. And when I have a patient come in to me and, for instance, a very anxious person, if I'll tell them from day one, look, we're not fixing this with this medication. You need to start counseling.
Mhm.
And they get that speech from me every time until they finally make that jump into counseling. I've got a patient right now that I'm working with, just diligently trying to figure something out
Mm.
to help their severe anxiety and agoraphobia, but it's just we're not finding that balance because they're so sensitive to every single
Mm.
medication that we're trying to
Sure.
put them on. And I told them, I said, look, we're not going to make any further changes until you set up an appointment with a counselor.
Mm.
Here's some options. let's make this happen. You make that happen, and then we'll see where we can go from there.
Sure. You know, I actually had a client where her anxiety was so severe and she was very sensitive to a lot of medications, not really uncommon with people that have like an autoimmune disease or connective tissue disease. She ended up finding that she had a very high mold toxicity in her body, which is often something we don't think about. Now, in South Louisiana, we should be thinking about it.
Thinking about that with everybody.
I know, right? But there was a very specific type of mold that she had a very high amount in her bloodstream that causes severe anxiety. So something that she did with her doctor was she was on an SSRI while her body was cleansing out the mold or even rebuilding her gut, because it does not happen overnight.
Absolutely.
You know, and so once again, it's a great tool as you are getting to the root cause.
Yes. We're hearing about that more and more, especially like you said in South Louisiana. I mean, the humidity around here. And I mean, you know, I know in the news recently, there was a bunch of houses that had mold in them. I mean, I guarantee you a lot of those patients, I mean, our people are going to become patients,
Sure.
you know, and
Sure.
that's something that it's not something that we think about all the time, but all these different avenues of, you know, sources that could be causing mental health issues are not always going to be fixed by medication.
Right. Or even counseling.
Yeah. Or even counseling.
You know? So
sometimes we need to detox people. We need to,
yes,
you know,
yes.
And so I know my wife, and I laugh at it every time I think about it, but I'm sure it had something. But, you know, when her kids were young, she used to, you know, detox them, and she would deworm them and detox them. And I mean, I don't know. It's anecdotal evidence, but look at them all. They're all fantastic, you know, successful. And so maybe that all works. So maybe we need to start deworming everybody.
Sure. We all got worms in our brain. That's what's going on. No, but listen, you know, I think even about like far infrared sauna. Like that is something we want to have at Lotus one day. Is I have one at my house.
Yeah.
My gosh, that helps me so much with energy, with my mood, with inflammation, just everything. And even just 15 minutes in it, you know, but it's stuff like that we don't often think about, or isn't maybe as easily accessible for many people, but it's especially, and I don't mean to sound political in this way, but we are in a very, very toxic world right now. It is in our air. It's in our food. Not knocking America, but I've had so many clients say that when they were in Europe, so many of their health issues went away because there's so many chemicals that are not approved in being in their food and water.
Yes.
So we're needing a lot more resources such as functional medicine and thinking outside the box to help with physical health, mental health, you know, so absolutely. I'm excited for y'all. I'm excited to be having this other piece part of Greenhouse.
It's definitely, it just kind of happened. You know, hopefully she's ready to be announced, but you know, Emily Douillon is, been a family nurse practitioner for several years, and she is now making a career change. And she is about to become a functional medicine nurse practitioner. And I'm so excited about this because, you know, now we got to figure out how to make all this fit into this. But, you know, just to have that extra avenue to be able to find other reasons, you know, and I've already got a list of patients in my head that I'm like, all right, you were going to see her, you're going to see her, you're going to see her. So, you know, hopefully we're going to be able to start utilizing more than just medication, you know, at Greenhouse. So
if there wasn't a mic right here, I would be doing cartwheels right now because I know you and Shonda's his wife, y'all's vision and y'all's dream. And I'm like, oh my gosh, it's happening. Like, this is so exciting.
Yep.
This is really, really big and beautiful things. I'm excited for y'all.
Yes. A lot of big things coming. You know, hopefully we just continue to grow. And, you know, I mean, my number one goal is to make an impact, not only just in Acadiana, but, you know, all throughout Louisiana. So,
right. Absolutely. And you just see adults, correct?
I see anyone from 18 to 65.
Okay.
You know, we treat pretty much every illness, you know, in mental health.
Yeah.
But yeah, that's our focus is, the adult population.
And like I said, what I love about Alan is, man, I can be in session and say, and I'm talking with a client, and Alan makes himself available to talk,
I will
and
if I
be
can.
there. Yeah, if you can, of
Yeah.
course, but be there for the client and not just. I don't know. There's something a little bit more that you provide than just medication management. Like you make yourself accessible and saying, "I'm journeying with you."
Yeah.
So
Well, I think, I love, and that's one of the things that I hope that we will see more of. And, and I know that there's a lot of hurdles to cross. I know there's a lot of roadblocks. I know it's not easy, but one thing that I hope we can, accomplish is that we're all on the same team. We've all got,
yes,
we've all got the same goal in mind if we're doing this for the right reason, which I hope that everybody that's in this, field of medicine is in it for the right reason. But we're all on the same, path to help make people better.
yeah.
We've got to figure out a way to make our collaborations like you and I have, having, and that's not to say that every time a patient has a problem, we can drop what we're doing and pick up the
Oh, of
phone. I get that,
course. Yeah.
but when that time is available, make it happen,
Right.
make it happen, because who knows, we might just be able to fix something really fast and prevent, these
A
illnesses from
crisis.
getting worse or
Yes.
going into a crisis, or,
Yes.
God forbid we lose a patient, from, to self-harm or something like that, because we didn't take 3 minutes to answer a phone call, and I get it. We're all busy. We're all, but there are ways that we can make this happen, whether we just take a few minutes after a session or even after work.
Yeah.
Just, look, we live in Lafayette. There is nowhere in Lafayette you can get in less than 30 minutes. Absolutely not. It's not happening. So, hey, pick up the phone. There's 30 minutes right there. If we can set up a time to say, hey, you and I have 2, 3, 4 patients together. I've got 30 minutes on my drive home or whatever. Let's discuss things. Let's see what we can do. What kind of problems are you having? What are you noticing? One of the things that I have a big problem with is, time-wise, I only get 10, maybe 15 minutes with these patients.
Sure.
Once a month, twice a month, once every 3 months, whatever. And,
The
when I
counselor
see
sees
them,
an hour,
absolutely,
often weekly.
and look, when I see that patient last, they may be fine. There may be nothing wrong with them. And then all of a sudden, 3 weeks later, you've watched this progression of a manic episode happening,
Sure.
that was not even present last time I saw them. And I may not have an appointment for 2 more months with that patient set up, but, just making that quick text message or phone call or whatever to say, hey, patient so-and-so is having, an issue. Do you think we can set up a phone call? Absolutely. Let's make it happen. So if we can do those types of collaborative, or take those types of collaborative steps a little bit more frequently, I think we're going to start seeing a lot better improvements in,
Sure.
in our patients.
Sure. And that's something I've always loved about your heart is you are in this for the right reason. It's not about making another buck. It's not about an image piece. And I always laugh if I see somebody doing that. I'm like, then you picked the wrong field.
Oh,
Now,
there
why
are
did-
way easier,
ways
better
to make
ways
money.
to make money. Oh,
Yeah, sure.
much
But-
less stressful.
Yes.
And probably
yes.
a lot more money involved if you go a different
Yes,
route.
Exactly. But, if you're in it for the right reason, I feel like that collaboration comes naturally. That discernment and how to care for the client comes naturally. And hopefully, too, the mental health professional is able to care for themselves. Because, gosh, that was something Trent and I wanted to be able to provide at Lotus and is in our mission statement. It's 3 things. It's to make wellness care accessible and affordable to all, but also to collaborate with other wellness providers in the area and build them up.
Yep.
But also to provide a wellness workplace that is life-giving and challenging and caring to the wellness provider, because we do carry a heavy load, so and I feel like you naturally have all 3 of those, which is
Well, I can definitely say that you have had a huge part in how fast my business has grown. I had this goal in mind that I was going to hopefully achieve in 3 years, and I'm about 80% or more there already.
it's not even been a year yet, huh?
I think
It's gonna be a
been
year in
right at-
October. We're in
in
September.
August. Yeah. August was a year for Greenhouse.
Wow.
And within that first year, I've already gotten 80% or more of the goal that I had given myself to achieve in 3 years. And I'm definitely thankful for all the counselors in this area from Lotus and Headspace that have given me the opportunity to grow my practice as much as I have.
Absolutely. And that just gets me excited because I'm like, oh, more people get to know Alan and more people get to be blessed by Alan.
All right, I'm gonna start coming here once a week for the ego boost.
I know, a little pep talk, yes. Alan, thank you so much for coming on today. Y'all, if y'all have not reached out to him, please do. He has just got such a good heart and wonderful soul and has blessed so many people in the area. His medication business is Greenhouse Psychiatric Services. And as you heard, there's going to be functional medicine services coming on pretty soon.
Very
so can even get that approach as well. So
well, thank you so much for having us. And, if anybody needs to contact us, obviously, if you're already with Lotus, that's going to be easy. But we could be reached at 337-247-7282. We're accepting new clients now. Usually I can get people in within about 2 weeks.
Yeah, which is amazing. Really, really amazing.
Yeah. And unfortunately, I mean, that's just, that's the way it is in Lafayette. There's a lot of, a lot of providers, but there's even more patients. And so there's several providers that I work close with that are 2-3 months,
Sure.
a waiting list. So right now's the time to get in. If you're thinking about medication, or if you need medication, or even if you're just curious to see if medication's right. Because just because you come in my office does not mean you're going to get medication, because there's plenty of people that do walk in my office and I go, you know what? This is not what you need.
Mm-hmm.
We need to look at some other routes.
Right.
So, but yeah, if you're curious, give us a call. We'll be happy to talk to you.
All right, you guys. Well, thank y'all so much for tuning in, and we will talk to you all soon.